Thank you to our follower for inspiring this tip request question about our top 5 do's and don'ts when it comes to obtaining observation hours. Let's start with our top 5 don'ts. Number 1, don't give up or become discouraged if you struggle to get into a clinic to obtain observation hours. Keep working, dig deeper into your network, and try something new until you achieve your desired outcome. Number 2, don't assume that a PT or a patient that you are observing is comfortable with you being there, asking them questions, or participating in their treatment. Always be respectful and always ask. Never assume. Number 3, don't stand in the corner of the clinic in silence, scroll on your phone, and ignore what's going on around you. This should be obvious, but this happens on a fairly consistent basis with either PTs, pre-PTs I've seen, or I hear horror stories from other PTs. Please don't be this type of pre-PT. Number 4, don't interrupt or distract a PT or a patient when they are interacting with each other. And number 5, don't sit by and do nothing if a PT, clinic staff member, or a patient is in need of help or could use an extra set of hands. Okay, that was painful. Let's get to our top 5 do's when it comes to observation hours. Number 1, do use your personal network to make natural connections with PTs to obtain observation hours. Once you know one PT, you can have a network to tap into and to expand your own network. Number 2, do set expectations and boundaries early in your observation hour experience. This will likely require you to have some conversations of setting expectations well before your first day of actually observing and obtaining observation hours. Know what the dress code is. Know how involved or uninvolved the PT wants you to be with patients, and when it is okay for you to interact with others in the clinic. Number 3, do be an asset, not a liability. When you're at the clinic, be of service, help out, fold laundry, grab or clean equipment, be friendly with patients, and help them to have an enjoyable experience. Make the PTs, staff, and patients look forward to when you're in the clinic and not dread when you walk in the door. Number 4, do write down your questions and wait to ask them until a time that's best for the PT or the patient. Avoid getting in the way of treatment or being distracting. Number 5, be present, respectful, engaging, and professional with everyone you talk to in the clinic. Keep your phone off and away when you are interacting with PTs, staff, or patients. When you walk in that clinic door, keep your phone off and away. Everyone is always watching you, so always be on your best behavior. How you go about obtaining observation hours as a pre-PT can make or break future job opportunities, letters of recommendation, and the size of your PT network. You don't have to be perfect, but establish expectations early. Always be present and be an asset, not a liability, and you will have a fantastic observation hour experience. If you have additional questions about how to obtain observation hours, go ahead and shoot us a DM or comment down below. Thanks for watching and have an awesome rest of your day.